there are basically three parts of the ear. So what you see is the external ear, and then we hear something called eardrum or kan ka parda. Till there, it is the external ear. From there, we have something which is starting as middle ear, and beyond the middle ear, there is inner ear. So there are three major structure of the ear: outer ear, middle ear, and inner ear. So when I say outer or middle ear, these are the conditions wherein a hearing loss, whenever it is there in within outer ear or middle ear, most of the cases, 90% of the cases, we are able to resolve this hearing loss. But if the cause is coming from the sensory neural, that is the innermost part of the ear, that is the ear which wherein the loss is permanent damage, and this is part of the ear wherein the hearing loss cannot be treated with just by any kind of medication or surgery. So now when we are talking about the occurrence of this hearing loss, so the sensory neural hearing loss at time of birth, it's around 3 to 4 kids out of 1,000 birth. So out of 1,000 birth, there are just 3 to 4 kids who are born with bilateral congenital hearing difficulty, which ranges from severe to profound. That means they cannot hear anything which is beyond a loud cracker or maybe an aeroplane passing by. So that's the kind of loss which occurs, which is of sensory neural occurrence. Now coming on to the conductive hearing loss, as we have I have also corrected just now, the any kind of hearing loss which is happening between outer or middle ear at the time of birth, it comes in forms of congenital deformities, or the pinna or the ear canal or the middle ear which is not being made or structured properly due to some reasons at the time of pregnancy, during the pregnancy. And majorly it is the first trimester of pregnancy which usually causes this kind of ear abnormalities. And these ear abnormalities gives us a rise of conductive hearing loss, which can be treated with some form of surgeries. And at times child might require some form of hearing aids or bone conduction hearing aids to cope up with the hearing loss which they get out of it. And the occurrence of this particular hearing loss is 3 to 4 out of 100 babies. So this is more common than the sensory neural hearing loss at the time of birth. So this is something which we are talking about, hearing loss at the time of birth. At the same point, I would also want to bring it to your notice that there is more to the hearing loss which we have seen. So it is not just at the time of birth that we see the hearing loss. We do have acquired hearing loss as well. So when we do talk about acquired hearing loss is something which was not there by birth, but due to some reason the child developed that kind of hearing loss. Again, talking to in two terms: sensory neural, something which cannot be corrected, or conductive. So sensory neural can be there in cases wherein it is because of some kind of genetic predisposition, and it is called as a progressive hearing loss, which was not there at the time of birth, but it is slowly progressing towards the higher form of hearing loss or hearing damage. The more common part of it is conductive hearing loss, which is due to abnormal ways of feeding. The posture while feeding, if that is not maintained properly, there are 50% of the kids before 5 years of age gets their middle ear infection or middle ear infected, and that's the reason they have a lot of pain into their ear. And that's the reason you would see whenever you visit a pediatrician, the first thing which they try to check the ear. They are trying to see whether behind the tympanic membrane is there any kind of fluid which is accumulated or something which is not going into notice and can cause a damage to the hearing. The fact here is, in many cases, visibly just seeing by otoscope will not give us enough information in terms of any kind of fluid behind the middle ear, but this can give rise to somewhere around 30 to 40 dB of hearing loss, and this goes unnoticed, can lead to permanent damage, also can lead to speech and language delay. So this is a more common cause in growing up kids till age of 5 years.